If you analyze the data in another way and look at the absolute proportion of patients with reperfusion times less than 90 minutes, these are the actual numbers of patients who had reperfusion times under 90 minutes, you can see that patients following the advent of pre-hospital ECG were significantly more likely to achieve a first medical contact to balloon time of less than 90 minutes, in addition to a door-to-balloon time of 90 minutes. Following this up, if you actually now use that four-group separation, you can see that over 80% of patients who were identified in the pre-hospital setting with in-field redirection had a door-to-balloon time of less than 90 minutes, with a 65% chance that you would have a first medical contact of less than 90 minutes. So contrast this with patients who were transferred in from a non-PCI hospital, fairly low numbers as would be expected, and consistent with the published registry and clinical trial data. Although not powered, there was no statistically significant difference in mortality between the groups. In-hospital mortality was low, at around 6 to 7%. And again, although not statistically significant, there was an interesting and tantalizing reduction in mortality amongst the patients who were identified in the pre-hospital setting, with numerical reduction in mortality compared to all those other patients who presented in another fashion to hospital. As mentioned above, the Vancouver Coastal Health Initiative is a work in progress and is constantly evolving. The next order of business for the region is for implementation of Phase 3, which is optimization of inter-hospital transfer for primary angioplasty across the region, irrespective of the receiving hospital for patients. We also wish to optimize and coordinate primary angioplasty activity with the geographically contiguous Fraser Health Authority. And in addition, we are working on ongoing PI assessment of integration of our STEMI database with the new province-wide acute coronary care and cardiac database. So in summary, our data has shown the pre-hospital ECG significantly reduces first medical contact balloon time and door-to-balloon time among STEMI patients appropriate for primary angioplasty. Moreover, we believe that this effect was demonstrated in a geographically challenging region for intercity EHS transportation. And finally, the use of pre-hospital ECGs was associated with a numerical reduction in in-hospital mortality. I'd like to close by acknowledging the input of a number of stakeholders which were involved in the evolution of our program. Obviously, all Vancouver Coastal Health STEMI Committee members, the input of Vancouver Coastal Health Authority and Providence Healthcare, BC Ambulance Service, as well as statistical support from the Provincial Health Services Authority. I thank you for your attention, and I'll be happy to take